Hello, welcome to Substance Use and Prevention presentation. My name is Rita Rasuli, Prevention Coordinator with San Joaquin County Office of Education. After this video, you'll be able to learn about substance use among youth, including the most used substances reported by teens. Understand how fentanyl affects drug use and addiction. Learn the risk factors for substance use and know some key protective factors. While most youth are in good health, some youth are at increased risk for behaviors that could lead to negative outcomes, such as high-risk substance use. High-risk substance use is defined by the CDC, or Centers for Disease Control and Prevention, as any use of substances by adolescents with a high risk of adverse outcomes, such as injury, criminal justice involvement, school dropout, or loss of life. Most adults who have substance use disorder began using substances during their teen and young adult years. The 10 most used substances by teens and adolescents, according to the American Addiction Centers, are alcohol, marijuana, nicotine, Adderall, opioids, tranquilizers, spice or K2, also known as fake weed, hallucinogens, inhalants, and DXM, which is an active ingredient used in over-the-counter cough and cold medicines. Youth who report opioid use are directly linked to sexual risk behaviors and are more likely to be a victim of physical or sexual dating violence. Drug use is also associated with mental health and suicide risks. According to the Centers for Disease Control and Prevention, or CDC, 15% of high school students reported having used illicit or injection drugs such as cocaine, inhalants, heroin, methamphetamines, hallucinogens, or ecstasy. 14% of students reported misusing prescription opioids. In 2020, there were almost 92,000 overdose deaths reported in the United States. Opioids are currently the main cause of overdose deaths. One of the biggest concerns related to drug overdose is fentanyl. Overdose deaths involving opioids rose 38.1% from 2020 to 2021. Overdose deaths involving synthetic opioids such as fentanyl rose 55.6%. Fentanyl is a powerful synthetic opioid that was originally used to treat chronic pain or severe pain, especially after surgery. Fentanyl is like morphine, but it is 50 to 100 times more potent and highly addictive. It is illegally sold in the forms of powder, nasal sprays, or made into pills that could look like real prescription opioids. The high potency, along with not knowing the exact dose of fentanyl that the drug contains, greatly increases risk of overdose. Illegal fentanyl is mixed with other drugs such as marijuana, cocaine, heroin, and methamphetamines. It is a gamble every time you ingest a drug because you won't know if it is mixed with fentanyl or not. Naloxone, also known as Narcan, is a medication that reverses an opioid overdose, which can save a person's life. This medication works almost immediately and has little to no effect if the person does not have opioids present in their system. Naloxone has few known adverse effects and has no potential for abuse. It can be rapidly administered through intramuscular injection or nasal spray. Studies show that substance use disorders are more likely to occur in the presence of certain risk factors. Risk factors for high-risk substance use can include family history of substance use, favorable attitude toward behavior from parents or caregivers, poor parental monitoring, association with substance-using peers, low academic achievement or school connectedness, childhood sexual abuse, and mental health issues. Adverse childhood experiences are stressful or traumatic experiences that occur during childhood. People who report adverse childhood experiences are more likely to report drug misuse. Those who report 5 or more ACEs are 4 to 12 times more likely to become drug abusers. People with mental health disorders are more likely to have a substance use disorder than those who do not. Mental health and substance use disorders are commonly found to be co-occurring disorders. About half of those who have a mental illness will have a substance use disorder at some point. Also, half of those with substance use disorder will have a mental illness at some point. Some protective factors that could reduce the risk of substance use in youth are parent-family engagement, family support, parental monitoring, healthy relationships, peer relationships, school connectedness, financial stability, and resiliency. The National Suicide Prevention Lifeline is a national hotline that is available 24 hours a day, 7 days a week to those in crisis. The number to call is 1-800-273-8255. Local and national resources are available to help people who may be experiencing a crisis. 988 has been designated as the new 3-digit dialing code that will route callers to the National Suicide Prevention Lifeline. When people call, text, or chat 988, they will be connected to trained counselors that are part of the existing Lifeline network. These trained counselors will listen, understand how their problems are affecting them, provide support, and connect them to resources if necessary. The National Human Trafficking Hotline connects survivors and victims of labor and sex trafficking to resources that can help them find safety. The number is 1-888-373-7888. The Trevor Project is a 24/7 crisis intervention and suicide prevention for LGBTQ+ teens. Text START to 678-678. NAMI, the National Alliance on Mental Illness, is an organization whose purpose is to provide mental health support to those in need. Their helpline is available Monday through Friday from 10 a.m. to 10 p.m. Eastern. The phone number is 1-800-950-6264. Or text NAMI to 741-741 for free crisis counseling that is available 24/7. SAMHSA's national helpline, 1-800-662-HELP, also known as the Treatment Referral Routing Service, or TTY 1-800-487-4889, is a confidential, free, 24-hour-a-day, 365-day-a-year information service in English and Spanish for individuals and family members facing mental and/or substance use disorders. This service provides referrals to local treatment facilities, support groups, and community-based organizations. FindTreatment.gov is a confidential and anonymous resource for persons seeking treatment for mental and substance use disorders in the United States and its territories. The California Healthy Kids Resource Center is a resource that is available to educators across California. This free lending library is available for educators to utilize within the classroom. Among other subject areas that promote health literacy, there are several curricula to choose from in alcohol and substance use prevention. Now it's time to test your knowledge. Using your phone or tablet, please scan the QR code to take you to the Google form for assessment. Once you have successfully completed the assessment, you will receive a certificate of completion in the email you provide. Thank you for watching this presentation on substance use and prevention.